Call the public hearing to order. Was the meeting properly noticed?
Yes, it was.
Roll call.
All members are present.
Okay, can I have an approval of the agenda? Supervisor Grabarski, second. Supervisor Pease. Any discussion? All in favor, say aye. Opposed? Thank you. We're now open for public comment. But I see there is no one here. We have to stay in session for 15 minutes, even though there's no public here. So at this time, Kyle, can you read the adjustment, advise us on the adjustments to the fee schedule and then the budget? And then we won't have to have that presentation during our regular meeting. Is that everybody okay? Yes, Supervisor Grabarski?
Just a quick question. Was there any correspondence from the public at all?
Nothing that I have received,
Okay.
Kelly. No,
Thanks.
nothing. Okay, Kyle, please.
Yep, thank you, Madam Chair. I'll let Wendy go over the fee schedule. And then once we get to the budget, then I'll just do the general overview of what is in the budget.
Supervisor Pease.
When we get to the budget part, we really probably shouldn't ask questions till the regular meeting. You just.
Correct.
Okay, just want to make sure that we know.
Yeah, thank you. Wendy?
I gotta figure out what to press. What do I?
Now,
No,
the fee schedule is just the fees that we charge for the services that we provide at Health and Human Services. The DHS one guidelines say that we have to have this approved annually, these rates. These rates have not changed since we did analyze them in 2022. We bumped up a couple of them. And then we've left it the same. So nothing has changed on this from what was approved last year.
I'm sorry. Okay, Supervisor Pease.
Okay. Right now, we have a placeholder for 4.0 in for wages. This year, we had a 4.0 wage increase last year. We know the CPI was a little bit over 8 last year, and it's running about 3.8 this year. Can we afford not to have a rate hike is my question. And I'm glad we don't have a rate hike, but I don't know how we almost can have one. So I guess I'd like an answer to that.
We did look at other counties around us to see if we were comparable. We still are. When we hiked them up in 2022, we hiked them up fairly, I think it was a 5% in 2022 that we hiked them up. So at this point in time, I feel that comfortable with the rates. We have to be careful because of the demographics that we work with. We don't want to discourage people getting the help that they need. A lot of these rates, no matter how much we charge, we're going to get paid maximum allowable as well. Those would be the clinic, all the Medicaid programs. We're just going to get paid the maximum allowable, no matter what our rate is. And then the family care rates out there are dictated through family care itself.
Supervisor Pease.
Is there any rates that are federally or state mandated that you have to charge a certain rate, even though if it's lower than what we would normally charge? Or is that what you're saying, what the Medicaid rate would be?
Yeah, Medicaid sets a maximum allowable rate. They will only pay you up to that amount. If you bill less than that, they'll pay you the lesser amount. If you bill more than that, they'll pay you up to the maximum allowable, and then we write off the difference. Some of that money comes back to the county through the WIMCR reporting though. So the rate doesn't make a difference. Our true costs in the WIMCR reporting will be where we bring in a little bit of extra money based on our actual costs.
Okay. Kyle? Wanna present on the budget, please?
Thank you, Madam Chair. So I'm just gonna kind of go do a general overview of what's in the budget right now. We have a placeholder for 4% cost of living adjustment for wages. Health insurance, we have at 16%. We had initially brought forward a budget presentation to admin and finance with a 4.9% cost of living adjustment. What we did with all of those wages and the associated increased benefits because of those wages, we moved 0.9% over into contingent. So down at the very last page of the Health and Human Services Department budget, you're gonna see it'll say contingency fund. I think it's like 50,000 roughly. I can't see that number. 58,107. So that is the cost of the 0.9, roughly the cost of the 0.9%, because we also had in there incentive pay or longevity pay for people who had been here for each year of service. We were planning on doing something, but that'll be potentially later on with personnel manual changes. So it's a little bit less than 58,000 was the cost of the 0.9% for Health and Human Services. And what's happening tomorrow at the county board meeting, as we were directed by admin and finance to bring it to the full board, there's going to be a vote on taking that 0.9% from contingency and putting it back to the wages and associated benefits. And I don't know if Wendy wanted to touch on anything specific within the budget, or don't we need to put you on the spot?
I did not plan to, but I welcome any questions when the board reconvenes.
Okay, I guess now we just have to wait another 7 minutes. Good news. Corp Council just advised that we can adjourn from this meeting, seeing as how no one is actually showing up. Go ahead. Oh. Okay. There being no further business, this meeting is adjourned. Now we'll call to order the regular meeting. Was this meeting properly noticed?
Yes, it was.
Roll call,
All members are present.
and I have a motion to approve the agenda. Motion made by Carlson. Second by Pease. Any discussion? Seeing none, all in favor, say aye. Opposed? None. Approval of the minutes from August 14th. Motion by Grabarski. Second by Carlson. Any discussion? All in favor, say aye.
Aye.
Thank you. Opposed? None. Motion carried. Minutes are approved. Public participation, there is no public here. Is there any correspondence? None. Okay, new business. Report from the departments, veteran service. Rich, are you on?
Yes, I am, Marge. All right, you ready?
Yes, we are.
All right, so for August, met with 51 veterans, had appointments. 287 phone calls, 233 electronic transactions. We had 3 outreach, health and welfare checks. And then just a couple highlights on the 8th of August, we had the CBSO VFW Congressional Liaison meeting. And then, oops, sorry. And then 8/14, we had the HHS Veteran Service Board meeting. And that's all we had for the August report. Any questions on that? And then the financials.
Why don't you move ahead to your September report?
Okay, so September, we met with 43 veterans. We had 332 phone calls and 232 electronic transactions. And then we had 6 health and welfare checks, appointments going out, making sure veterans were okay, and doing some claims at their homes. On the 24th of September, we had the WDVA monthly training. And then the 28th, we had department head retreat. I did at the Petenwall Park. And then the 29th, I had a county veteran service quarterly meeting training down in Greene County Veteran Service Office. And that's it for that report for September. Any questions on that?
Rich, I just want to mention one thing if I can, Madam Chair. Hello?
Yes.
Yeah, I
Yes,
want,
yes,
I
go
want-
ahead.
all the members that came to my dad's funeral in the end of August did a wonderful job in service and presentation and shooting off the guns, and it was beautiful.
Good. That was the Adams County color guard, correct?
Yep.
I'm just blowing up phone calls everywhere. I got an outreach appointment I gotta get to. And Baraboo, I got a widower stuck down there. She has to get down to Salvation Army shelter tonight, so kind of rushed right now. Sorry for that.
Okay, any further comments or questions for Rick? Seeing none, thank you, and you can now leave for your next meeting.
All right, thank you very much, Barb. Thank you, board.
Okay. Report from the departments. Kelly,
Our July and August financial reports are in the packet. Are there any questions about them? If there's no questions, do you want us to go on to the narrative?
please do.
Narratives for September and October are also in the packet. Any questions about those?
Doesn't appear to have any questions on those.
Moving on to project status report. That has been updated. I would say our biggest and most exciting news is the fact that some of the vehicles are coming in. We do have some of the Equinoxes, which are being utilized, and we are excited to have those. We still don't have all of them, but we do have, I believe we have 5 right now. That's probably our biggest thing to highlight. We have had 5 Equinoxes come in.
Are there any other questions? Okay, report of committee members, Aging Advisory Committee.
Donna, do you want to give an update on that?
Sure. We met last on August 10th. And we went over our program reports from March, June, and July. And then we went over an advocacy 2023 to 2025 state budget comparison report. And we also went over the aging plan review, which we have to do every year, the 2022 to 2024 aging plan. That went very well. We also discussed the request for proposals for the nutrition program, so the board was aware of that. We then talked about the farmers market nutrition program and how that was going. In August, it was a slow start, but then eventually it picked up. We talked about our local events and how to advertise those better. Then we went through our June 2023 financial review, and our next meeting will be November 2nd at 1 p.m.
Does anyone have any questions for Donna on her report? Seeing none, we'll move on to the Coordinated Services Advisory Committee.
I would ask Diane to give an update on that.
Thank you, Kelly. Yes, we met on October 10th. We had a discussion on recruitment of new committee members because we've had quite a few resign from that committee. We also shared the proposed interagency agreement. And the next meeting, we are looking to hear about some adult services in the community, and we are going to ask Friendship Connections to come and give a presentation. And then the program statistics were also presented at that meeting.
Anyone with questions for Diane? Excuse me. Okay,
Question,
yes, go ahead.
how many committee members are you currently looking for?
I believe 4. Kelly Malecki just resigned. It was 3, and then Kelly got a job during the day, and she's not able to be on our committee anymore. She was probably one of our longest standing members. The others, one passed away, one moved out of the area, and one does not attend the meetings. So it would be 4.
Are these public committee members?
These would be, yes, citizen committee members.
Okay,
Mhm.
thank you. Okay, next on the agenda is administration, discuss 2024 departmental budget. We've had the presentation. Kelly, is anything you have to add or?
I think the only thing that we would add is, we have eliminated 2 positions in this budget. That includes the elimination of a fiscal billing specialist in the fiscal division, as well as the elimination of a social worker position in children and families.
Supervisor Pease?
Is that elimination due to, I know why the financial one was done, the social worker, was that due to not being able to fill it, or why was that eliminated?
That position was eliminated. Ever since 2020, the caseloads have dropped significantly and they have not rebounded since 2020. So in the event caseloads come back up, we would seek to fill that position, but because caseloads are down a little, that's why.
So do you believe this is a good thing, or you just think that we're missing people out there that aren't willing to come to our health and human services?
This is generally, the caseloads that we have are generally involuntary caseloads. They're the Child Protective Services reports or youth justice. This is something that has been seen across the state as caseloads really dropped after 2020. Hard to say why necessarily, but we do expect at some point they will rebound.
Well, I just read a report that they're missing about 8,900 school children from last year and even more from the year before that. So I wonder if this is part of that also.
COVID really, in our opinion, isolated people, and some families really pulled back and isolated. So it's possible that some of these families are just more isolated.
Any other questions? Supervisor Kozlowski?
Thanks, Madam Chair. This budget is difficult to understand. Just haven't been clarified on a lot of things here, and I think it'd be good. And I don't want anybody to see this as a combative way or any kind of a threatening way, but I'd like to motion to look into this budget, basically conduct a functionality accountability audit into this budget, just to make sure that everything's functioning the way it should be. And I think this would be in the best interest of everybody in the committee, just to know that that is the case. So I'd make that motion now.
I guess I'm not sure what you're asking for.
Just the audit, the report of the budget. Accountability, functionality.
We have a motion on the floor. Is there any second? We have a second. We have no second, so the motion will die.
Thank you, Madam Chair.
Any other questions? Okay, hearing none, the budget will move forward to the full board. Oh, Kyle, I can't see you back
Sorry.
there.
One more thing that I forgot to add with the tax levy, you're gonna see, Kelly's gonna shoot darts at me with her eyes here. You're gonna see about a $500,000 increase on the tax levy for Health and Human Services. I just wanted to point that out because in the past, we haven't really funded Health and Human Services to where it should have been. They have in the past, they did have negative fund balances. So we've been slowly trying to help increase the Health and Human Services funding. A lot of the reason that we're able to actually increase the Health and Human Services funding is due to solid waste no longer being on the tax levy.
Okay, thank you. Supervisor Pease?
Having said that, we ended in the black last year. So what is the influx of that money for then?
My understanding is the majority of that increase is wage and fringe. And then
What-
also our out-of-home care placements, generally where we overrun as placements.
Your first answer leads me back to what I said in the other thing about the not increasing the fee schedule. You see what I'm saying? I mean, that's the answer I was looking for in the first place, is how can we not increase it? And then we have an influx of cash there.
Back to Wendy's discussion about the fee schedule. So she talked about the max allowable and Medicaid sets a rate. So even when we set our rates higher than that, some of these rates we won't even get. One of the other issues we have with our budget is DHS 1. So the ability to pay, so we can set fees at a rate that's comparable to private or public entities. But if someone does not have the ability to pay, we can't require them to pay. That's a DHS rule. So in some regard, it is hard to generate revenue. We can also not profit off of Medicaid.
Does that answer your question? As best as possible?
That's probably the best as possible.
Okay. Are there any other good discussion or comments? Okay, the next on the agenda, agenda is the fee schedule. And is there any further explanation, discussion on that?
Going back to the budget. If you come out in the black again this year. Does that, well, I guess this is a Kyle question. Will we have to always give them money to meet their wage schedule from now on?
Madam Chair?
Yes, Kyle.
Yeah, it really depends on what other funding sources there are available as well, because a lot of the positions, they are partially funded through grants. Some of them are on tax levy, but then we are able to allocate some of those costs as well through AMSO. So it really depends on outside funding as well. So there's a mixture here.
Supervisor Pease.
Because now that I'm thinking about this, if we're gonna defund two positions with benefits, I'm assuming that's approximately $150,000, if not more than that. So we're really increasing that budget by $650,000 because we're decreasing, but also adding in $500,000.
I don't know if Wendy wants to take that. Our positions are a little more tricky because sometimes they are allocated to a grant. So they aren't necessarily fully on the tax levy, or they're claimed in part of the billing rate, the rates that we can set, we're able to offset some of those costs. So it's not necessarily dollar for dollar. Did I answer that okay, Wendy?
Yes, I would just add to that, like, take the billing specialist, for example, that is paid for out of administrative funds. At the end of the day, all of the administrative funds are divvied out across all the other different grants based on the FTE count involved in those grants. So some of it stays on tax levy, but a good share of it, if time was spent on a grant, the administrative costs get allocated to that grant based on how much time was spent in that grant, which is what the FTE means for that. So it isn't dollars for dollars.
Thank you. The best answer possible.
Thank you, Wendy and Kelly. Supervisor Grabarski.
Yeah, regarding this fee schedule, was there any changes in that? I didn't notice anything highlighted, so it stays as status quo. Is that correct?
Correct. Nothing has been updated or increased since 2022 when we did a 5% increase.
Okay. I'll entertain a motion to approve the fee schedule as presented. Supervisor Grabarski, second. Second, Supervisor Carlson. Is there any further discussion? Seeing none, all in favor, say aye.
All right.
Hi.
Opposed?
Aye.
Motion carried with Supervisor Pazowski dissenting. Next on the agenda is the Practical Sense Quarterly Financial Report.
So this was on the agenda for last month. We just wanted to give everyone a quarterly update on how Practical Sense is doing. if you kind of scroll down to the bottom, you'll see that they continue to have a profit at Practical Sense. They continue to do real well, not only providing a place for people to learn job skills, but also providing thrift clothing and other articles to the public. And we're still able to generate a profit.
Supervisor Pease.
Is this a quarterly profit or is that a from year-to-date profit?
That's a year-to-date profit.
It'd be quite a quarterly, wouldn't it?
And it does include our ongoing donation cost because we, as an agency, are able to provide donation to the public. And that is also included in that rate or in that dollar amount.
Any other questions or comments?
I have a question.
Okay, Terry.
Yeah, what does indirect offset mean?
Hey, Terry, that indirect offset is the indirect costs that are charged to Practical Sense from the indirect cost plan for costs that belong to the county, but are then allocated out across all the other different departments. The offset means it's the expenses and the revenues offset each other because it's not a true cost. It's just something we use in order to draw down grant dollars and such. We are able to include those indirect costs. Does that make sense?
I'm not real good in this stuff anyway.
So it's not a true expense for us because it's just our costs of the county's costs for maintenance, IT. So we have to offset it with a revenue line so that it doesn't affect our budget.
The indirect is also one of the reasons you see it in each section is then we can also claim it in our grants. It's another way to pull down additional dollars to cover the costs of doing day-to-day work.
Thank you.
You okay, Terry, with that answer?
Yeah.
Okay, thank you. And finally on the agenda, public health, harm reduction vending machine. So share some information on that, Cody.
Sure, take a look at the screen there. That is our public health vending machine. We were awarded the grant back in the spring of last year and it finally arrived 4 weeks ago. Some things that you might see in there are toothbrushes, toothpaste, COVID test kits, Narcan, fentanyl test strips, and eventually shampoo, deodorant, self-care products, and then tickets for our Lyme disease season coming up next year. We've currently had this machine for about 4 weeks. We've gone through 75 toothbrushes, 100 toothpaste, and over 100 mental health products. When public health was looking at this grant, we were looking at the needs of our county from an equity approach and a systematic approach. We wanted to address barriers, prioritize resources with the greatest need, and lastly, help our communities make informed choices. So that's kind of what the basis of our public health vending machine. It is an evidence-based program and a harm reduction tool. It's a tool for prevention, but not a way to solve problems as a whole. Any questions?
Are there any questions from the committee?
Yeah, is the vending machine, excuse me, is the vending machine only located at the social service building?
Correct. Yeah. So we had the option for an outdoor or indoor machine. Working with some key stakeholders in the community, we elected to get an indoor one. So it is at our Health and Human Services building. Operates from 8 to 4:30. The machine is free. We try to get community members to take one item at a time. It's been very hard to keep it stocked, but we use some of the funding to keep it going for our community needs.
Thank you.
Supervisor Grabarski.
Yeah, how did we end up with this brainstorm? Just kind of curious here. If we hadn't had a grant would we have done anything like this?
Cody, go ahead.
Yeah, so we have, yeah, definitely, no, through our, community action teams, our child and our CHIP, we itemized mental health and access to care. And access to care is one of our top 4 priority areas. So when looking at the public health vending machine, we wanted to use evidence-based programs to kind of help have more access to our community. So some of the biggest things that affect mental health is oral healthcare and oral care. So having toothbrushes and toothpastes definitely helps our community in those aspects, but also Narcan and fentanyl test strips are in there as well. And those are also evidence-based programs to help reduce those overdose deaths in Adams County. So that's a big factor for that too. So to kind of add on to that with the Narcan and fentanyl test strips, it's just an extra add-on that we have to kind of offer toothpaste and dental care and self-care products to our community, which we are serving low income and at-risk populations.
Now, this is something that wouldn't have been available with a different avenue somewhere. I mean, I guess I don't understand the vending machine part.
Sure. So it's to help increase access to care. The originalities of the grant was through the Narcan program and the public health vending machine program. So a lot of the items in the vending machine will be Narcan and fentanyl test strips. Through incentives through public health, we decided to put in some extra products for our community because we're serving an at-risk population and low income.
Cody, one final question then. These things have to be, do they have expiration dates on them and so forth? And if they do, how is this made sure that they're not expiring?
Yep. So everything with the vending machine is through the grant. So we can't purchase anything without the grant dollars. The Narcan, the fentanyl test strips, everything has expiration dates on them. And then there's a monthly data collection that's being conducted and also an annual report that will be sent to you guys too. Thank
Are
you.
there any, okay, Supervisor Pozdowski?
Thank you, Madam Chair. Just a concern observation. This seems like it could be causing a disconnect when someone comes in, they're in front of a machine, getting something, possibly missing an opportunity to identify the needs, other needs of somebody that might be coming in for these items. I don't like that along those lines, but secondly, how much was this machine? I might have missed that, but can Cody or Kyle, anybody tell us how much this machine cost?
Cody can answer that, I believe.
Yep, I can answer that. So the public health vending machine is a 3-year grant. The grant funded everything that you see in this machine, and we'll see in the future. The grant was for $45,000. The grant paid for the machine and the maintenance and the electrical, which was a total of $3,100.
So how much was the machine, Cody?
Yep, $3,100.
Okay.
And that came through the $45,000 that was with the grant.
Okay, so where is that other money? I mean, does that go into the supplies?
Yep, it goes to the Narcan, ordering the fentanyl test strips, all that stuff. So, so again, we don't pay for anything outside of the grant for the machine. It all comes through the grant.
Okay. All right. Thank you for that, Cody.
Thank you.
Madam Chair.
Anything else from anyone? Okay, seeing nothing else. Our next meeting is November 13th. Supervisor Pozdowski.
Madam Chair, I brought this up in the last meeting, but I'd like to put on the agenda something for discussion on how these meetings are being recorded. I don't know as we're getting the full picture of our members of the committee in the video. And I'd like to look at ways that we can change that.
See what we can do. Don't think we have too much control over that, but we'll see if we can come up with an answer for you.
Sounds good, Madam Chair. Appreciate that. Thank you.
Okay. As always, if there are any further agenda items, please get them to Kelly, Liana, or myself. And the next meeting is November 13th at 4 p.m. Seeing nothing else before us, I call the meeting adjourned. Thank you all.